Well, August marks 5 months without gyms, and that means 5 months without work for the fitness industry. For some, it means 5 months without the mental sanity that gyms offer, whether you're an industry worker or a fitness fan. On Wednesday, 12th, at 2 p.m., gym employees and fitness enthusiasts will participate in peaceful demonstrations to protest against gym closures. The protest will be headed by FitSA, the Association of Health and Fitness Clubs in the country. Let's talk more on this. We're joined now by FitSA spokesperson, Mr. Grant Austin. Grant, a very warm welcome to you, and thank you so very much for joining us here on SABC News.
An absolute pleasure. Thank you for having me.
Just as a start, Grant, let's talk about how badly your industry has really been affected. I mean, you've not really, in this time, actually have a chance to reopen even slightly or under any changes. Talk to us about how that has really affected the industry as a whole.
Look, it's had varying effects, but it's been quite devastating on the industry. It's tough for any business to go 5 months without it. And, it's a fairly large industry. We employ close to 30,000 people. We have close to 2.1 million members. We've got, 1,100 odd locations around the country. And, it has been pretty tough, I must say.
Now, the problem with gym is that, people breathe heavily, they sweat, they have to touch equipment, all of these things that cause, the spread of the coronavirus. What's the plan on your side if you were given the opportunity really to continue with the business, but also, not spread the virus any further when gyms are really sort of a fertile ground, one would think, for the spread of such a virus?
Yeah, obviously we're very aware of that, and certainly we wouldn't want to put any of our members or staff members' health at risk. And a gym is used to keeping a very sanitary environment. We also have access control systems, so we can, see who does and doesn't come in. We can send out pre-screening letters. Anyone with a comorbidity, we would encourage them not to come in. But generally our base is a lot healthier than the rest, and in fact our demographics, there's a very, very small percentage, like 2.5% of the people that are really high risk age groups. So, we're used to sanitizing, we're used to having high levels of cleanliness. Our member base is healthy. In fact, there was a study done in a gym group in Oslo. I think there's about 1,800 participants. And they ran it for a couple of weeks, and they found not one single COVID-19 infection. So whatever the reasons for that are, I think pretty much what I've mentioned. But we feel that gyms are actually a really safe and secure environment for our members and our staff to be in.
Grant, talk to us about your planned demonstration, what you plan to do, and I suppose you'll be maybe sending out some kind of a proposal or memorandum of sorts, and really what is your proposal in terms of opening up? I mean, it's not just the government that you'd have to convince to open up, to allow you to open up gyms again, but you'd also really have to sort of convince the general public, who might in fact be scared to go back to gyms. So what exactly is the plan? I mean, I do know that you mentioned the fact that gyms historically, we know they get clean, sanitized, all of that. That is part of the business. But obviously now it'll have to be more than what you would generally be doing anyway. Yes. So what exactly would you then be proposing then to not just the government, but also your clients or potential clients who would be kind of scared to go back to the gym?
We've, as an industry, we developed a set of opening protocols in conjunction with a team of occupational hygienists. And we've actually got it's like a 30-page document in terms of what we'll do, where we'll sanitize, how we'll do it, how we'll make our members and our staff aware, the training that we'll give our staff to make sure that the members feel comfortable. Something like wearing of masks will be mandatory, and we've done some quite extensive research into that. Even I was concerned about wearing a mask, but having read the research and having actually tried exercising myself, I personally found that it's more a perception thing than in fact a barrier to exercising. So we're very confident that we can bring our members back happily and safely and get them going again. Also 5 months of no exercise has a significant effect on your immune. And there's all kinds of other knock-on effects. For example, the South African Depression and Anxiety Group, they're reportedly having double the number of calls since lockdown. So they're having 600 a day. They're now having 12 a day. So people's immune system, their mental sanity, all of those things come into it. And in fact, the single biggest indicator of a bad outcome in COVID-19, as per a study done in Wuhan on 191 patients, was that obesity is actually the single biggest indicator of whether somebody's going to have a high mortality rate, require ventilation, and spend additional time in ICU.
Yeah.
So really, we feel that gyms are part of the solution, because all of the comorbidities, hypertension, high blood pressure, obesity, heart disease, etc., diabetes, all of those things are what our product actually combats those things.
All right, Grant, thank you for chatting to us here on SABC News. We appreciate your time, Grant Austin.